The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Thank you for joining us at today's press availability webinar for Access Health Connecticut. If I could ask for a moment, on the bottom right-hand side of your control panel, you have a chat box. Could you please identify yourself on the chat box by name? That would be very helpful. Thank you. Good afternoon, everyone.
Good afternoon.
This is Evelyn
This is Evelyn Martinez, the moderator for today.
And I apologize for taking a couple of extra minutes. I don't get your name
as signing in.
So I opened
up the line for audio.
To identify yourself.
To identify yourself, let us know that you're on with us.
Hi, this is Ana Valentin Jackson with the Latino Way.
Welcome, Ana.
Welcome, Ana.
Thank you.
Thank you. Who else is on the line?
Thank you. Who else is on the line?
Okay, very good.
Okay, very good.
I appreciate your participation.
I know it may not be
easy to unmute.
We're going to do
video with a presentation. So if you can give me a moment, I need to make sure that I'm going to record today's webinar and we will make it available to everyone afterwards. So with just a moment, let us begin. Alrighty. Welcome to today's press availability with Andrea Ravitz. Andrea is the Access Health Connecticut Director of Marketing and Sales. And you see in the webinar screen that we have a couple of housekeeping items for conducting today's press availability. You are automatically muted, and we would like to reserve, there will be a short presentation, and we would like to reserve questions and answers for after the presentation. So what I'm going to do is encourage all of our participants to, on the chat box on the lower right-hand corner of your control panel, to type in any questions that you may have. If you have any difficulty with your audio component, or you wish to call in instead, switch from audio to in the control panel, switch your audio and it will give you a number to call. So again, welcome to today's virtual press availability for Spanish language media. I am Evelyn Mantilla and I will be your moderator for today. The purpose of today's press availability is specifically to target the members of the media in the Spanish-speaking community so that they can help us get the word out about the importance of enrollment and give you some of the details about how Access Health Connecticut is working very hard to get everyone enrolled. I'm happy to present to you Andrea Ravitz, Director of Marketing and Sales from Access Health Connecticut. We had planned on having Dr. Victor Villagra join us, and I do apologize. I'm not sure if he may be having some difficulty joining in. But if he does at some point, we'll be thrilled to have him be part of the conversation. Again, let me make sure that I have, now my screens are not moving. There we go. Great. One last housekeeping thing that I want to share with you is that this is considered a press availability. Today's session is on the record, and we encourage you to use this important information for your stories. También quería dejarles saber que en este evento podemos hablar en inglés, podemos hablar en español, podemos ser bilingüe, queremos que sea lo más conveniente para todos ustedes. Así que con gusto les presento a Andrea Ravitz.
Gracias, Evelyn, y gracias a todas las personas que nos están pues oyendo y pues que están aquí por una misión y un evento tan importante como es el evento de inscripción anual. Si en algún momento necesitan que hablen español, con muchísimo gusto. Por el momento la presentación va a ser en inglés, como Evelyn decía, pero estamos aquí a disposición de cualquier persona que necesite o quiera cambiar a español. So the first thing that I would like to say is, one very important thing for us is to start with the basics, and that is to really explain to our communities who Access Health Connecticut is. And I think that the easiest way to put it in simple words, I would say, is Access Health Connecticut has been the office that has been implementing the Affordable Care Act, also known as Obamacare by a lot of our community since 2012. And since then, we've had a mission and vision that has really driven all of our efforts that, yes, they change on a year-to-year basis, but our focus continues to be the same, which is the reduction of the uninsured rate in the state. I was brought up in this organization as the person that was going to head the multicultural events, communications and marketing, specifically targeting our minority communities with a big focus on the Hispanic community. So know that this is and will continue to be a huge part of our efforts. So let me tell you a little bit about Access Health Connecticut and what makes us so unique here in the state. So Access Health Connecticut is the only place where consumers can get financial help to be able to purchase. When they purchase their plans, this financial help allows them to get some assistance to be able to pay for that coverage. As of right now, the open enrollment for private health insurance, also known as qualified health plans, started November 1st, and this is one of the reasons why we're having this very important webinar. It's ending around the corner on December 22nd, so we do not have a lot of time to spread the word. It is really important for all of us to make that effort of spreading the word. All the help that is offered via the phone, online, in person is free to our consumers. Even those certified brokers that are the only ones that are able to recommend a plan allow people to come and get their advice for free. I also want to remind everybody that just like the first year when this law was implemented, there is a tax penalty of $695 for not having healthcare coverage. But our focus is not, that is more informational. We want to make sure that people in our communities see the value more than the facts of the law. So let me explain a little bit what we've accomplished since in this open enrollment specifically. Like, again, I said, it started November 1st. It's really important to remember that back in 2012, our uninsured rate here in the state started at 8%, and right now we're sitting at a 3.5% as of last year. So it's a great and tremendous effort, but we know that our job is not done. As you can see on the screen, so far, as of the 30th of last month, there has been great interaction with people that have never had plans, people that have plans in the past, and people that decided to renew. So we also have seen very healthy numbers on the website visits and calls that are being answered. As you can see, they're all surpassing 100,000 on both the website and calls answered. I also want to mention that Access Health Connecticut is also a door for those eligible for Medicaid, but a quick reminder that this open enrollment period does not apply to those eligible for Medicaid, in which case it can come throughout the year. On the next slide, we're going to see, talk a little bit about why we're having this conversation and what is our challenge. As you all know, there has been a lot of confusion since 2 years ago that it became pretty evident that this was going to be an important topic for not only the state, but for the nation. So there's a lot of confusion coming from the Capitol. And there's some things that impact Connecticut. There's some things that do not impact Connecticut. So let's start with things that do impact. And that is if, the constant mixed messages that are coming with bills. The latest bill that incorporates the potential for the repealing of the mandate. And to remind everybody, in 2012, when this was implemented, this law was basically saying that everyone who's eligible for coverage needed to have coverage. Otherwise, there was a penalty. If the mandate goes away, that changes. That means that people still are eligible, but they're not required to do so. A very important reminder, the bill or a bill does not change a law. This is something that is being proposed, but as of right now, it hasn't changed anything. And the reason why it affects Connecticut is because it creates noise, it creates confusion amongst our communities. The other big thing that are actually turning into what does not affect Connecticut. At the beginning of this open enrollment, we heard a lot of confusion around lack of funding for community outreach and cuts to 90% of marketing spend. This does not affect Connecticut for the reason that we do not belong to the federal platform. Our advertising and community outreach specifically have been actually increased, even though the enrollment period decreased by almost a month. So people need to understand that the open enrollment period is here, that it's a shorter open enrollment, that it's ending in a couple of weeks on December 22nd, and that we are the only place where people can get financial help. So again, important dates to remember. November 1st is when it started. December 22nd is when it ends. People that come outside of the open enrollment period can enroll only if they have a special situation in their lives. This is called a special enrollment period. And that qualifies for people that experience a life-changing event. And that life-changing event could potentially be, I got married, I had a kid, I adopted a kid, and others. I lost a job. So very important to remember, especially to our communities. We want to avoid people coming at the very last minute, that they have until December 22nd. And all the coverage starts on January 1st, 2018. Once again, to remind everybody that Access Health Connecticut offers private health insurance through Anthem, Blue Cross and Blue Shield, and Connecticut. And for those eligible for Medicaid, there is insurance through the Department of Social Services with Husky Health and the Children's Health Insurance Program, also known as CHIP. Also, a reminder to everybody that the private health insurance, which is, to clarify, a paid insurance, comes in different metal levels. As you can see on the screen, we have the gold, the silver, the bronze. And these levels are meant to provide choice to consumers based on their needs and their family's needs. So really important for people to look at their options before they select the cheapest plan. A very good reminder, we are, like I said before, the only place where people can get financial help. And we get this question all the time, how easy or difficult it is to get this financial help and what is it based on? Financial help is determined by the person's age, income, and where they live. And just for you all to have an idea, close to 80% of our consumers in 2017 plan year received any type of financial help. And this could be significant for a lot of families that, depending on their income, could potentially be paying in the single digits for a plan for their families. So again, financial help is available, and this screen specifically shows the amounts where people are eligible for financial help through private healthcare coverage or financial help for individuals and families, and also those that, due to their income, are eligible for Medicaid. A reminder that Medicaid is a free type of coverage for those, as you can see here, a single person with an excess of $16,000 and a family of four, a little over $38,000. On the next screen, we want to reiterate that we are here to help. We have a 24/7 online website that it's available in English and Spanish at accesshealthct.com. We also have a call center that now is available to all consumers Monday to Sunday. 855-805-4325 is the phone number. We speak over 100 languages. This is really important because we know that our diverse community is something that we need to take care of, and not everybody is on the boat, that understands English and Spanish. So that to us has been and will continue to be a huge priority to make sure that we can assist people in other minority communities. And finally, in-person assistance. As most of you know, in the past we've had enrollment locations around the state. We were able to relocate the 2 that we had for the first 4 years to open 10 around the state, and to be complemented by 5 enrollment fairs. There are 2 enrollment fairs left, one this Saturday, one the following Saturday. I would recommend that you go into our website, accesshealthct.com, or to and click on Get Help, or a more direct link will be that is shown here on this screen. So let's talk a little bit about the Latino community and some of the impacts that we've had as a state ever since the Affordable Care Act was implemented. So these stats are as of 2017. This is a study that the Connecticut Health Foundation performed, and it was described as a very successful, very impactful type of research. As you can see on the screen, 8,000 more Latinos have healthcare coverage on the individual market. 33,000 more Latinos have healthcare coverage through Medicaid, and 38,000 fewer Latinos are uninsured. That is a 35% difference. This is incredibly, incredibly important for a couple of reasons. In the event that the mandate goes away, these figures could potentially change dramatically. In this case, with the mandate being something that is incorporated on the Affordable Care Act, this is telling, like I said before, anybody who's eligible is required by law to have healthcare coverage. If the mandate goes away, those that are eligible can choose not to buy healthcare coverage. And as a reminder, what this is bringing is instability to the market, or what it could bring to the market. Why? Because now we have a good mix of pool between people that are heavy users of the healthcare system and people that are healthy. And so this is something that we are going to continue to monitor. This is really important for us to have a benchmark that 35% of these people in our community are insured because of the Affordable Care Act. So more to come on that. Another very important topic is, and we get this from our Latino community a lot, is what's happening to families arriving from Puerto Rico due to Hurricane Maria. And I just want to reiterate that we are welcoming calls and person help from anybody that is opening their doors to family members, especially children, that need to have healthcare coverage. So please help us spread the word. These people need our help, and we are here to help. The enrollment locations or centers that I was just talking about, these are 10 around the state, and you can see them on the screen. Please make sure that you spread the word. These are great centers for people to go ask questions, enroll, and be able to choose the best plan. These individuals that are certified through Access Health Connecticut are there Monday to Friday with their arms open to make sure that everybody, whether it's a question or they're ready to enroll can do so. Also on the enrollment fairs, like I said before, we have 2 enrollment fairs, one in Hamden this Saturday, December 9th, and in Willimantic on December the 16th. So once again, these are the 2 fairs left. Open enrollment ends December 22nd. This is a very quick representation for everybody's sake to understand the amount of help that we have this year in our state. A lot of the areas that you see in with whitish spots or that we don't have offices, please remember that these locations and the in-person help goes above, beyond the circles that you see. So we have the website that is available 24/7. We have an enrollment center, 10 enrollment centers. We have the Department of Social Services offices. We have hundreds, and when I say hundreds, I mean hundreds of certified application counselors and brokers around the state. And I believe that the brokers are not included here, but we have hundreds of them around the state that can help our constituents enroll. Very brief on the advertising campaign. Many of you have seen our marketing messages. It's really important that if you have a question, that you give us a call. If there's a story that you would like to write, that we have the support, or you have the support to be able to write in the right way to the community that you serve. So if there's any opportunity for us to partner together, please reach out to us. We want to make sure that we are providing with all the information that you and your community needs. So engaging with your community, like I was saying, there's we have open arms for a partnership. We have been for the past 4 years doing a lot of speaking engagements. We have been to a lot of events, fairs, and festivals. We do a lot of educational webinars that are very similar to what we're doing right now. We provide informational materials. There's research and surveys with stats that are really important for you guys to know, to be able to talk about it, how it affects our community, and of course, our yearly planning sessions that really allow us to build the strategy year to year. If you want to become, or if you know of a community partner that should be part of this important message, you can send them this email outreach@accesshealthct.com. So the most important thing after receiving all this information is, what can you do with it? And the number one thing that I would say is to share this information. We are extremely concerned that a lot of our minority communities are being left behind. They're confused. The constant mixed messages are not helping the message continuing to be the same. They are hearing different stories. Some of them feel that this law is no longer the law, and therefore they're not going to sign up. We're trying to avoid all that, and we need your help. Make sure that you continue the conversation, not only with your community, but with us. If there's anything that you need from us, we are here. And lastly, stay in touch. There's many ways for us to talk to you, whether it's via phone, email, on website, or through our social media platforms that are just a click away or a phone call away for us to serve you and your community. So I would like to right now open the floor for questions. If everything that was presented was clear, that will also be something that will be useful for us and other times. So I would like to open that.
If you have any questions for Andrea, feel free to type them in the chat box, which is at the lower right hand of your control panel. We hope that this information is helpful to you as a member of the press. We hope that the data that has been presented today can be disseminated, that we can show it by way of our articles and the coverage that is provided by the press. So again, if you have any questions of Andrea, feel free to type it on the chat box, and we'll make sure that you get an answer. And I do want you to know that we're very appreciative of your participation today. Access Health Connecticut cares a great deal about how we reach the Latino community, and your participation today helps that along. So we are very, very appreciative. All right, I don't see any questions just yet. While we do that, actually, Andrea, let me ask you a question then, because as part of the outreach team, we're out on the field all of the time. Tell me about what you think are the worries that folks in our community may have that may prevent them from coming forward and getting enrolled.
Yes, Evelyn. There's a couple of concerns that we hear in our community, and number one is I didn't know that the open enrollment was shorter. I did not know that this continued to be the law. I wasn't aware that there was financial help. So there's a lot of questions that, a lot of our messaging has been hitting that very, very frequently to make sure that they understand. But most important, we acknowledge that this is a very complex process and that there's a lot of in-person help, free in-person help available for our community. And that's probably one of the most important messages to deliver to our community, that there is free in-person help, that there is financial help available to pay for that coverage, and that this continues to be the law. The more that we hear in national news, I think it gets confusing. Not everybody's aware that a bill is not changing anything until it becomes a law, and for that to happen, there needs to be a long process. And even when things become law, some of them do not take into effect right away. So confusion coming from the Capitol, but most importantly, focusing on what's happening right now, knowing that we are about 10 days away or a little bit more before the open enrollment period ends. It's a big concern.
Great. Thank you, Andrea. So again, to reiterate that the Affordable Care Act is the law of the land right now. The opportunities to enroll are here. We don't want any of the families in Connecticut to miss out on having their health care coverage. And this is why we are pressing the information out as much as possible, and really appreciate your help in doing that. All right. I don't see any other questions for Andrea today. So with, again, thanking anyone who took the time to participate, those of you who are part of this conversation, I want to let you know that we have recorded today's information and we'll make it available to you, most likely by email, and we will point you in the right direction so that others in your offices may be able to also partake in this information and help us spread the word out. So with that, Andrea, I'll say goodbye for today. Let's keep up the good work and get the word out to the Latino community as much as possible. Don't forget, December 22nd is the deadline. That is the day to pay attention to. It is before then that we want our families, our Latino families, to make sure that they get the help that they deserve and the coverage that they need. So with that, I will close the webinar. Thank you.